Many Nigerians don't want to die, despite the complaints they make about the country. But only a few have personal commitment towards keeping safe. That's because a large number of the country's population, especially those who live in local communities, say COVID-19 is a political viral disease that the government is using to enrich its own pocket.
All the old money they are collecting is just for nothing. Without you know, maybe there's corona, maybe this street now, this K2, just bring maybe 10 or 5 outside for you to see. You can't see. You now say 100, you see 1,000. That's a big lie.
Coronavirus in politics is politics, real politics.
Why?
Because Corona Nigeria is scam.
Here on the streets are still many doubting Thomases who do not believe that COVID-19 exists, and these people could actually be asymptomatic, not showing any sign of the virus at all, meaning they could just be spreading it without knowing.
A good number do not use face mask as they go about their daily obligations. Some say it is inconveniencing.
I'm not confident very well. I'm not breathing very well.
Feel suffocate too, and not let me breathe very well.
To others, social distancing is an obstruction of real existence, which cannot be made a norm in the African setting. However, some believe the government is doing the best it can to curb the spread of the coronavirus, but in the midst of deep hunger that must be tackled first.
What I believe that we're supposed to do is also find a way around it and allow business to continue.
Government should be able to talk to people, and not just only that, government should also touch the lives of individuals.
But the truth is, COVID-19 is real, and it has infected over 12 million people globally and killed more than 500,000. The virus is still ready to kill more people who shun safety measures. Medical experts are very concerned about people with underlying ailments, especially the elderly, who must adhere strictly to precautionary measures, because having to use a ventilator to stay alive is tougher than many people know.
You have to intubate, what you call intubation. You open your mouth, instrument goes through your mouth, go through your throat to place it in the pharynx where the oxygen will be exchanged. Oxygen and carbon dioxide will be exchanged. This is not an easy, it requires skills to place it, and that could cause inconvenience. And of course, to even maintain it in place, it's another job entirely, to supervise the ventilator as well, to make sure that it is working, the gases are being exchanged. Don't forget, it also requires electricity to work.
Those who say the use of face mask is inconveniencing should listen to this.
But think of you in the hospital battling to save your own life, and doctors and nurses and workers battling to save your life. Remember the money, the expenses is expensive, and it's a risk. You are not even sure, nobody shows you will live, nobody can predict if you will live. So face mask at best, the cost is in maybe 1,000 or 2,000 naira. There are some that are 400 naira, 200 naira. It's cheap. Prevention is better at any point in healthcare. Any point, anywhere in the world, prevention is forever better than cure.
When doctors emphasize precautionary measures, they do not expect those listening or watching to take their words for granted. That's because medical advice ensures the safety of lives. Jacqueline Ogo, TVC News, Lagos.